Good afternoon, Lisa Homa here. Hope you're all having a great day. Today we're going to be talking about thinking upstream, theory and population-focused nursing care. The objectives of this lecture are to explore cultural differences that impact healthcare and healthcare delivery. We're going to be talking about how communication varies slightly, and we're going to be looking at this from a transcultural perspective. And let me just break down transcultural for 1 second. So trans, T-R-A-N-S, is the Latin prefix and it means across or through. So what we're going to be looking at is we're going to look how population health from a lens across many cultures. And the last part we're going to be talking about is how we use informatics to inform our practice, how we use that data to support our role as a nurse, as a population health nurse. On to Chapter 5, Ethical Quandaries in Community Health Nursing. Now, before we go any further, I want to mention that there's much overlap in the content with ethics. And the only parts we're going to talk about here is we're going to talk about the parts that are unique and specific to the population health nurse itself. The central elements of healthcare ethics, the first part, it's central to nursing, right? It's in everything that we do, all decisions we make, we have to think about the ethical considerations first. The second part of it is it's a philosophical pursuit of doing good and what is right. It's the overall cause of what we do. And the third part to consider, as a nurse, we think of people as inherently good. Our ethical perspective as a population health nurse. However, the law considers people bad, which is an interesting perspective. We want to also have respect for people. Every person in the community has intrinsic value, and it's up to us to illuminate or highlight a role that's significant in that community. The second part is applying this principle to community health directs healthcare professionals to evaluate the effect of proposed initiatives in light of their implications for all people who may be involved. Let me give you one example of this. So give careful consideration before introducing Western medical practices. The way we look and view health and disease management and all of our healthcare could directly be contradicting to Eastern medical practices. In population health, I think more than in any other course, understanding cultural norms and how they believe healing occurs and all those aspects are just so super critical to what you'll be thinking and navigating with your projects this semester. Ethical quandaries in community nursing. And this we have seen just in the events of our nation this year. So diversity and complexity of communities inevitably lead to a plethora of conflicts between and among these principles, no question. The second piece of this is most frequently the course of conflict encountered by our community health nurses. Cultural complexity is a huge thing that our nurses have to navigate when we consider making improvements in health status and for example, getting certain populations to change their health behaviors. And let me give you one example. So one of the first programs I built actually wasn't an academic program. I built a bariatric program. And in the local community, we had a really significant Arabic population. It was critical to success. We had to remove sugar from their diet. A very strong cultural hold about the foods they eat. So that was a really difficult thing for us to re-educate and to talk to them. And plus, we don't want to violate any of their religious beliefs, to think about all those things that impact the culture that you're working with. On to Chapter 6, Community Empowerment. So there's a framework for community empowerment. Historically, these are the approaches we have observed. There's the medical approach, which is old. It's like when I started out as a nurse. Controlling and curing disease, that's the focus of the medical profession. And then we move towards behavior modification. So essentially the health service approach is just modifying behaviors to improve general and overall health. The third one that you're looking at is community development approach is where we are today. So we want to be in partnership with our community. We want to help educate the community that we're working with and help them to make informed decisions which can ultimately prevent illness and improve their current health status. We want to also work on developing right relationships. And if you think about it, what we do as a nurse, one of the most important things we do is we start to build relationships from the second we introduce ourselves to that patient. So for a true relationship to develop, there has to be a balance of a lot of things, right? We want to balance unconditional acceptance. So we have to view that person, whatever person or community we're treating, we have to look at them holistically, again, as a systematic or systems approach, that our patient, our individual, our community is influenced by so many other factors that can impact their experience. The second piece of it is the transformation of becoming whole. It requires a right relationship. And so who are our empowerment people within the community? And what this says just basically is it talks about self-transcendence. And this is significant to us as E-Town nursing students because our comfort theory uses transcendence to transform our people that we're trying to help. Remember, transcendence simply means if our patient is in pain, we want to bring them to a state out of pain, bring them into a state of comfort. We want to remove them from where they are and bring them to a higher state, elevate them. And this just talks about the same thing. So nurses play a critical role in this process of helping communities, families, and all the way down to the individual level by helping them to become whole and to facilitate right relationships. So who are the positive forces in that community? Is it a very strong community of faith? Are there strong youth programs by rec programs or things like that to help empower and bring that community to a higher level? And then we talk about empowerment of consciousness. This gets really deep. And all this really talks about is that us as human beings, if we want to begin this process of empowerment and educating, we have to have a spirit of openness and be willing to engage in a dialogue that helps to facilitate new ideas. If you have people that are closed-minded and are not interested in what you have to say, you're not going to get very far. There has to be a spirit of openness. And then with that, there's a process of hope, trust, faith, and critical thinking based on mutual concerns. And essentially, I know this sounds like maybe a little kumbaya, but it's truly about loving one another and overall love for human beings. And on to chapter 7. This is cultural competence, discussion, and tools for action. So cultural competence, as we discussed in our previous course in holistic health assessment, that it's very difficult for us to truly become cultural competent. So really a more realistic goal for us is to become culturally sensitive and to be all-inclusive and provide equitable care. So the primary factor for providing quality health, especially in the community, is understanding the framework or the lens of where they're coming from, regardless of their culture or their religious preferences, whether they're disabled, they have a different sexual orientation or gender identity, which is different from others. It's okay. We have to understand and embrace that and then meet them where they are and then give them relevant education and supportive services to help them achieve whatever it is that they want to achieve. Current initiatives. Let's talk about where we are in the world of cultural competence. Well, if you watch the news, I find it very depressing. It doesn't seem like we're very far. But what I will say is this, I'm going to bring this back to a research perspective and try not to have it be political in any way, shape, or form. So let me just share this about research. Do you know that in the United States, we didn't even start doing research on women until the 1980s? I mean, all research studies were only performed on men. Imagine that. That is why we knew very little about heart attacks in women. We didn't know how women manifested cardiac symptoms differently than men because we just simply never studied them before. So if you apply this concept now, right now there's research that's now done equally on men and women, but think about all the populations and all the different cultures who have come here to the United States that we don't even know anything about. In the literature, we know almost nothing about the LGBTQ population. We know almost nothing. When it comes to sexual identity questions, this is why all of our health screening forms within acute care they're not sufficient. They do not address any of these other populations at all. That's why there's healthcare disparities. And being honest in healthcare, we have had a one-size-fits-all approach for a very long time. And it's no wonder why our patients are screaming that we're missing and we're creating all these gaps in their care. It's no wonder that has happened over all these years. So remember, nurses care for everyone. And it's our job now, we may not have thought this initially, our job is to be a competent nurse. But now we know that to provide the best care, we also have to understand all those holistic factors that also impact their care. And it's so central and so critical to what we do. We need to understand their basic traditions and how all the cultures and ethnicities all tie into how they feel about health and illness. The culturally competent provider. So this is the goal. It implies that we need to have an awareness of ourselves, right? So we have to understand our own biases, which is why we try to bring in implicit bias to realize how much it impacts how we view the lens with which we treat patients. And then we need to understand the meaning of culture. And that happens just slowly over time, that we understand little bits and pieces about each one of these cultures, and then we can apply it right away. The first step, again, is awareness, and then acceptance of those cultural differences, and that's okay. And then many ethnic minorities have beliefs and practices about health and illness, again, are very, very different than how we practice our Western scientific medical paradigm, and we have to start having an understanding and learning about the Eastern practices because they all live here now. Each person is responsible for building awareness and then understanding how the way they think impacts the way that they treat their patients. On to Chapter 8. So I'm going to get a little Florence Nightingale on you here for a second to talk about policy. Nightingale believed that creating policy was also being an active participant in a positive process. She did not view policy as a negative thing in any way, shape, or form, which is very interesting. She was so revolutionary for her time. From the great words of Flo, I have a direct quote from her, and now think about this. Every great reformer began by being a solitary dissenter, but in every case, it was a positive dissent, ending not in protest, but in great reform. Think about the opposition she faced when she tried to bring clean water, clean dressings, sunlight, clean environments, and all those things into this. She received so much opposition from physicians. They thought she was crazy, but she viewed this whole process, and what an incredible impact she has had on healthcare in general. We don't even give her the credit that she truly deserved. Policy making begins by recognizing the problem of interest and presenting it to our policymakers. They are in control of our resources, and that's why politics is so darn important to us. Because if our patients are screaming for something, we have to use policy as the vehicle to be able to get resources to our communities and other places. And it's really critical in population health. Politics is just the process of influencing the allocation of scarce resources. It's a manner by which the politics operate. Hopefully it's positive and not negative. It depends on, let me give just a little bit of my opinion with this as well. In any program or anything I've ever tried to build in healthcare, you're only as good as your administration. Meaning, if they're not open, if they're not supportive, if they're not going to give you the resources that you need, and maybe you can relate this to watching where you work. If they don't give you the support you need, you're probably not going to be able to accomplish or transform a culture or provide the education that you want based on what they're giving you. And I feel like this is the same thing with politics. If our politicians do not understand what's happening to our communities, if they don't have all that in context, and if they're unwilling to have an open dialogue and they're not willing to give the individuals our community support, then we are nowhere. I don't know how we're going to accomplish things. They have to be in collaboration, in partnership with us. Briefly about informatics. And whenever we mention informatics throughout all of the program here at eTown, we're just using data to inform our decision making. And it's really important in population health to use the data. And as you're going to be pulling data together, you're going to see how transformational that really is. And you're going to see the risks and gaps in your population's care. It's going to be amazing. By the end of your subterm, your view on population health is going to be so different. We're going to use electronic sources to retrieve health information. And one of the most important things that you can view online is vital statistics. You can get our census data, our demographic data, and those things are all important in helping you to have a fundamental understanding of the needs in your community. And that's it for me. I hope you have a great rest of your day.